Are you seeing turbo cancers in the injected and uninjected people since 2020? And you know what we mean by injected and uninjected? If so, how is this changing diagnosis and treatment? In my mind, the best way to avoid chronically fermenting cells is to live like you already have it. However, is this still enough? If not, what is the same and what has changed? In your opinion, are IV and other therapies still effective post 2020? Actually, very good question, Donna. What they're calling turbo cancers are due to multiple things, multiple factors. For example, I just read a paper where they found SV40 in these injections, by Pfizer and Moderna. The SV40 simian virus number 40. It's the same thing we found in the prevention of polio that they gave to children. SV40. Anyway, simian virus number 40 is pro-carcinogenic. Okay. And anyone who's ever had a polio injection is going to have SV40, and SV40 is carcinogenic. We know that. That's one reason. There's that in there. The other one is that it's very much, these injections by Pfizer and Moderna definitely disrupt the immune response. And so it really kind of wipes out the innate immune response. And there are two parts to the immune system. Number one is the innate, which you're born with. The other one, the adaptive, you have to develop as you grow. As you age and you run into things. But the innate is the natural killer cells, the neutrophils, the macrophages, the dendritic cells, monocytes, things like that are just ready to grab things. Macrophage, large eater. It's a big eater. That's what it is. It's phagocytic. Phagocytosis means to eat, to engulf. And so that's what macrophages do. So do dendritic cells. So do neutrophils. They're phagocytic cells. So anyway, these injections actually really disturb this whole innate immune response. And they shift from Th1 to Th2, so it's not really active and it's really just chronic and just lying around. Okay, so it's not really healthy. Not really healthy at all. One study says here, therefore, we believe that the anti-cancer effect of ivermectin is not limited to cytotoxicity, that is stimulating the cell to die, but also involves the regulation of tumor microenvironment. So the ivermectin mediates immunogenic cell death, which may be a new direction for research exploring anti-cancer mechanisms in the future. Yeah, so it's pretty amazing. So it's one of the things you always want to do. Before we let anyone inject us with anything, have us swallow something or snort something or anything with our body, it's precious. Make sure you know, without a doubt, what it is that you're putting into your body. Okay, make sure that. Don't ever do, and also don't believe me and don't believe anybody anymore in this world. Okay, if someone tells you something, say, okay, that's great, guy. Can you show me the research you read that gave you that opinion? Okay, if you're talking to a doctor at the hospital, you're talking to me, you're talking to anyone, make sure that they can show you what how they came to this conclusion, and that is not just some bright idea of theirs. Okay, that's what's important, and I love that. So I'll share it all. I only do that. I don't make things up. Can you imagine? So yeah, these turbo cancers. Yeah, we're doing the same things. We've got to give a lot of extra. We've got high D dimers, which is blood clotting. So we have to give nattokinase. We have to give lumbrokinase. We have to do a lot of chelation. The other thing we do is something called double filtration plasmapheresis. It's actually a piece of equipment. We have it in Thailand. We're getting one in Arizona. And what it does is it takes your blood and filters out stuff. And what we're finding in people is big clots and all kinds of stuff that is being filtered out. And it also filters out, you see, if you do something called the serum protein electrophoresis, which is a blood test that shows the proteins that are in your blood, right, which include albumin and the other ones. So when you do that, there's a normal kind of, so like with multiple myeloma, right, where you have a difference in the M protein spike and stuff, and there's different kinds of, they call blood-based fermenting cells. For example, if we did a serum protein electrophoresis and we find the alpha-1 is really high, now we know there are lots of immune suppressive proteins. So we do a double filtration plasmapheresis, we clean those out, the immune system gets charged and goes to work getting rid of these fermenting cells. So it's very, very important, especially if people that have been injected, to find somewhere. Now, one of the second best is the EBO. EBO is, extracorporeal blood, ozone, and oxygen, right? So it's where they put a catheter in here and a catheter in here. They take it out, they filter it through with a microfilter. micrometers, whereas the double filtration plasmapheresis is actually nanometers, 20 nanometers, tiny, tiny. You clear out everything. But the microfilters of the EBO, and then it ozonates it. It's a great way to, even for those who are not even really sick. But even with that, we're seeing large clots coming out, all kinds of garbage in our blood, and remember, it's not only those injected, we're seeing this stuff in people who weren't. So this double filtration plasmapheresis is amazing. You got to find someone near you that does it. If not, do the EBO for sure. The EBO, really, really important, because you got to clean out some of this junk. It's a much quicker way than, doing a fast, because a fast takes a while to do it. You still want to do the fast to change your biology, to bring your biology back. But in order just to filter the blood right away and take away the immune suppressant proteins, all those sorts of things, quite phenomenal.